morning, Culver City. I'm your host, Ana Maria Ramos. Thank you for joining us in the session of Public Health today. In the past few weeks, we have seen that our Congress has unsuccessfully tried to pass a health care reform. That is up until last week, when our House of Representatives created a new proposal. This proposal has many concerns of what will happen next. Joining us today, we have Republican Representative Tom MacArthur, Public Health Official Kim Chung, and our very own representative of District 37, Congresswoman Bass. We also have with us today two of our very own community members, Miss Andrea, a college student, and Miss Hannah, a mother whose child was born with pre-existing conditions. Welcome all. Now I'm sure our constituents have a question or two for our representatives. Our first guest is none other than Republican Representative MacArthur. Good morning. Thank you for joining us today. Can you give us a little insight on the new proposal?
Thank you, Anna, for having me here. As you already know, I'm the person responsible for the proposal of the latest 2.0 version of the American Health Care Act, which unfortunately failed to make it to the floor in order to repeal and replace the Affordable Care Act. I made this proposal in an attempt to meet everyone's needs in this nation by making health insurance more affordable and more easily accessible for everyone, and by promoting a better and more cost-effective quality of care. The first version of the American Health Care Act had many flaws, and we did our best to address those, and I firmly believe that we did that, although it still didn't gain the support that we expected. So this amendment would essentially maintain many popular essential benefits that were guaranteed under the Affordable Care Act, such as coverage for maternity care and emergency services, and would reinstate essential health benefits as federal standards. And on the other hand, it would maintain some of the provisions of the American Health Care Act. But the most important part of this proposal is that it would give states the option to seek waivers from certain federal standards, such as essential health benefits and community rating rules, with some exceptions such as gender, age, or health status. But it needs to be pointed out that the states could only do that if they showed that that would lead to lower premiums and more people getting insured.
Thank you, Representative MacArthur. With us today, as mentioned earlier, we have two constituents from our very own District 37, who, like many of you at home, have concerns with the new proposal. Welcome, Ms. Calderon and Ms. Hannah.
Hi, Anna. Thank you for having me here. I have a question for you, Representative MacArthur. I'm a student at West LA Community College, and I only go to the doctors about once a year for a physical. I work part-time, I don't have any kids, but my premium is pretty high considering that I don't make that much money. How will this proposal help me?
So one important reason why individuals like you would benefit from this version is because under Obamacare, insurance companies were essentially required to force younger adults to subsidize older people. So there will be a limit for older people that they could be charged only 3 times higher than younger adults. But this will change now with the new bill, since the limit goes to up to 5 to 1. And this will essentially reduce the premiums for young, healthy individuals like you.
So what you're saying is that my premiums are going to go down because with this new bill, states are going to be able to charge unhealthy individuals more?
Wait a minute, my situation is totally different. I'm a housewife who is raising this beautiful baby, Bella. My family has a private insurance through my husband's company, but Bella was born with congenital heart disease. My ACA, she could have a surgery without worrying about economic burden. She was having surgery, but she has to go through 3 more surgeries in the near future. So is she going to be denied from being covered through an insurance? I'm really terrified. My new health insurance company, and that affects to my policy, and it will impact my family really bad.
To better answer your concerns, Ms. Hannah, we brought in Public Health Official Kim Chung, who has been closely monitoring and examining the new health care proposal, and our very own District 37 Representative Bass.
Thank you, Anna. Thank you, Hannah, for sharing the story with us. That's exactly what I concern about this new healthcare law. It could effectively make the coverage completely unaffordable to the people with pre-existing conditions. And under the new health care, the state can allow the insurance company to set much higher rate for the patient who have the pre-existing conditions. Also, the bill cut the value of Obamacare insurance subsidy in half and let the insurance company charge older Americans 500% more than they are charging the younger Americans. Also, they offer $100 billion in tax cuts for the rich. So we can see that this bill is more beneficial for younger and healthy people who need help less. Because the people that older, sick, and poor people, that is the one that they need help the most, and they have been driven out the market. And it's also according to the CBO, there will be 24 million people uninsured by 2026 under this new health care.
Thank you. That was great information. From the beginning of the year, I have received many calls from my constituents who are afraid they're going to lose coverage for their loved ones and find that they're going to be receiving less services, yet they will be paying more. Although the Republican stands say they will improve access, it will only be for those who can actually afford it. I have voted 56 times against repealing the Affordable Care Act. And I will continue to do that because I believe in affordable health care for everyone. My constituents are part of that 14 million people who are afraid they will lose their coverage. I ask my constituents that they please contact me in order to tell me their stories so I can continue sharing it with the rest of the Senate. I will continue communicating with my constituents through Facebook Live, and I ask for them to write me letters and call me so that I can share their stories with other representatives. I also encourage them to write to Senator Feinstein and Senator Harris in case this bill passes because they have the ability to vote against it.
Thank you all for coming today. That is all the time we have. Tune in tomorrow for another section of Public Health Today. Stay woke, Culver City.